Now to Dr. Manuel Serrano from Spain. Manuel has been a medical doctor in Spain. He trained at the University of Pittsburgh in the USA as well, in clinical research, and is currently a consultant at the Department of Health Quality and Research, Health Council of Murcia in Spain. He's also trained at Stanford in the USA and is a master trainer in self-management for chronic diseases. Currently, he's the president of education at the Health and Society Foundation and is a director of the Expert Patient Program in Spain. So he's another qualified person to give us a patient perspective.
Thank you very much. On my presentation, I'm going to talk about the way we followed from a national self-management support program to an international research network initiative. That's the reason for the title, From the Expert Patient Program to the Global Self-Management Support Alliance. This is the new chronic care model based on the works of the McCall Institute in the United States. In this model, 4 key actions were considered at the community at the health system levels. These 4 actions are self-management support, delivery system design, decision support, and clinical information systems. 9 of each 10 papers published since 2003 regarding the new chronic care model have used some kind of self-management support programs as an intervention for disease management. But what is self-management about? As Dr. Julie Barlow says, and we will watch her in a video in a few minutes, self-management is the individual's ability to manage the symptoms, treatment, physical and social consequences, and lifestyle changes inherent in living with a chronic condition. It is impossible not to self-manage. Sometimes we self-manage our health in the wrong way, and others we do it in the right way. What's the reason for these differences? As Dr. Lorick, director of the Stanford Patient Education Research Center, says, if people don't want to do something, they won't do it. We need to give patients the motivation and trust on themselves to live a healthier life and to feel in control on their own health. The Chronic Disease Self-Management Program started at the University of Stanford in the late 80s for patients with chronic disease. The program is focused on the chronic care patient as a person. It can be attended at the same time as a generic intervention by patients with different conditions. All chronic care patients suffer on their health similar problems such as anxiety and depression, sedentarism, management of complex diets, taking of medications, problems on their relationship with their physician, or problems at work or at home because of their disease. At the CDSMP, during 6 consecutive weeks, 2 trained patients acting as tutors teach to a group of patients on a weekly 2.5 session hours how to make resolution about their health, positive thinking, how to make an action plan, resolution of problems, taking of medicines, and how to acquire diet and exercise healthy habits. The patient also learns skills of communication with his physician and how to integrate his role of chronic care patient in his family and laboral life. More than 50 clinical trials have been published about the efficiency of this program on the literature, with results on quality of life related with health outcomes and in reducing costs for health systems. The CDSMP have been spread all over the world to more than 20 countries, and the Education and Health and Society Foundation is the reference institution to run this program in Spain. Our program in Spain is called Programa Paciente Experto, Expert Patient Program. In 1 year, we have reached 300 patients in Spain coming from patient associations. We have recently signed an agreement with the Spanish Coalition for Chronic Diseases to roll out the program all over Spain. This coalition is an organization with 2,000 associations of patients in Spain, representing 1,700,000 patients on the country. The Expert Patient Program has an interest in the corporate social responsibility area, since empower patients and workers to overcome their chronic disease. We run also some programs for immigrants at Spain, since going to other countries affects their habits on self-management. The program also has been applied to aging and disabled people at the US, diminishing the levels of dependency. There are also programs specifically designed for the health of carers suffering on their own health, the stress as caregivers. Okay, but it will work, this program, in my country. During this year, we did contact the main teams in Europe, developing self-management programs with the goal of exchanging experiences with them. We did visit the EPP program in England, where it's planned that 100,000 patients will receive the program in 2012. And the universities of Coventry and Manchester. Now we are going to watch a short video about our meetings there and how that visit was the beginning for the Global Self-Management Support Alliance. This video will be also available at the presentation website of the World Congress. This video is a short version of a longer video. It's available at the webpage, eppspain.org, and you may check the whole video there. Since our visit to England, we contacted research teams for other 10 countries, and now we count with an advisory board of 16 experts coming from 11 countries: United States, Canada, United Kingdom, Denmark, Norway, Sweden, Lithuania, Poland, Romania, and we have contacted other groups in the field of self-management. We have named this network the Global Self-Management Support Alliance. The role of the whole list of members of the advisory board is available. The whole list is available at the page selfmanagementsupport.org. We are, what is this Global Self-Management Support Alliance? Sorry. We are a group to help public and private institutions to develop, validate, and implement self-management programs worldwide. We count with our own private workspace for collaborative work. We have some projects ready to be presented to the stakeholders and policymakers in the next few months. And we are planning to organize the first international forum on self-management support, that it would be mostly developed through video conference for the end of this year. We will provide self-management support training through the Breakthrough Series College methodology. We are particularly interested on the training of healthcare providers to be successful on the implementation of self-management programs. We think it's essential to have them on board. Our foundation joined the Breakthrough Series College International Network, led by the Institute for Healthcare Improvement at the US. And from October of this year, we will use this Breakthrough Series College methodology to run collaborative projects regarding self-management support in Europe. The training of healthcare providers and patients will be also carried out through video conference meetings. It is an honor for me to be presenting all projects here. And finally, I want to thank the organization of the World Congress inviting me to join this event. Thanks for your attention. Hopefully, very soon, we will be able to meet one of the main missions of our foundation, to empower chronic care patients and families, and to promote self-management of health worldwide. Thank you.